Welcome to the Learning Center, a place where nurses can learn and discuss the newest and best practices to triage their patients.
Once you finish watching this video, you should expect to achieve the following goals. 1. Understand what information to gather during the call. 2. Learn the essential steps to triage a call appropriately. 3. Learn how to ensure that patients feel their questions are being answered and they're being heard. And 4. Understand the proper steps to stay within the scope of nursing. Let's start by outlining the 10 critical steps to taking a triage call. We will walk through these quickly, and then in future slides we'll go through each of them in more detail and explain the significance of each one. 1. Introduce yourself. 2. Collect the demographic information. 3. Get a brief medical history. 4. Get a history of the patient's current illness. 5. Identify the chief complaint and the most serious symptoms. 6. Select the correct protocol based on the patient's symptoms. 7. Triage the patient based on the protocol and get them to the right disposition of care. 8. Provide care advice. 9. Give clear and specific callback instructions. And 10. Wrap up the call and make sure the patient has no other questions. When you take a triage call, that first introduction on the phone is going to set the tone for the rest of the call, so that when you call the patient back or you call them on the phone, you need to make sure you have a smile on your face, you're not distracted, and you're ready to be empathetic. That initial greeting and how you talk to them is going to help them trust you and know that they're going to be taken care of. So for example, you might say, "Hello, good afternoon. My name is Emily. I'm a registered nurse calling back from your doctor's office. I'm sorry to hear that your child is sick. Let's go over everything and see how we can help you today." The key points to include in your introduction, in addition to your positive and empathetic attitude, is a greeting which includes the time of day, your name, what your role is in the office, where you're calling from, why you're calling, and most importantly, reassure them that you are going to help. Once you make your introduction, the next critical step is making sure you have accurate information about who you're talking to and who their physician is. This is important because after the call is completed and documented, it needs to end up in the right chart for proper follow-up. If you have the wrong patient's name or the wrong physician, something could get missed and lead to a serious lack of follow-up. At a minimum, you need to get the patient's name, date of birth, a phone number where they can be reached, and the name of their physician. If it's an after-hours call center, you need to confirm what practice they're in so you don't get the same name of a physician for a different practice. Now that you've established a relationship and verified the critical demographic info, it's time to get into the triage portion of the call. Before you get into their current symptoms, it's important to get a brief past medical history. In order to make the patient feel like they're being heard and still get the information you need, one of the ways to start asking the medical history is to say, "I know you're calling about a fever today, and we're going to talk about that, but before I get that information, I need to get some more important info from you so we can make sure we're doing the right thing." This is going to be a focused and brief past medical history. You can also keep it brief by asking things like, "Do you have any medical conditions for which you're seeing your doctor on a regular basis?" Or, "Do you take any medications every day or every week? Have you had any recent surgeries or stayed overnight in a hospital in the last 6 months to a year?" This will get you the critical information you need if there are any serious medical conditions. Take, for example, a liver transplant patient. If you don't ask, they may forget to tell you. But that would seriously impact your decision if they're calling with a fever, since they're immunosuppressed. So a brief medical history with the basic relevant medications and surgeries in recent months is very important to any appropriate triage. Now this is the important part where you let the patient tell you what's happening with them. There are 2 parts to this piece of triage. One is you're listening to see what the most important or dangerous symptom may be. The second is you're learning what the patient is concerned about. Because if you address the symptom that is medically important, but you don't address the patient's concern, they may feel like they're not being helped, and they're either going to call back or go to the emergency room because they haven't had their concerns answered. So again, and this is really important, you need to do these two things. As the medical professional, listen for the more important and dangerous symptoms. And as the empathetic professional, you need to listen to what the patient is concerned about so you can address that part during the triage process. In medicine, we are all under time constraints. There's a limited amount of time and resources. So during this part, you need to practice the art of listening while still directing the patient as needed. If they head off into various details that you, as a medical professional, know are not relevant, you need to regain their focus by saying such things as, "You were talking about the onset of vomiting. Can you tell me a little bit more about that?" But you still need to give them a chance to tell their story, say 30 to 60 seconds, and continue to pay attention, because if you cut them off too soon, you may miss an important symptom, or they may feel like they're not being helped and the triage will have been a waste. We're going to talk in more detail about teasing through the different symptoms and picking the correct protocol as we get into other lectures. For the scope of this lecture, it's important to note that this is one of the critical steps of a good triage call. After getting the demographics, a brief medical history, and letting the patient talk so you get a good picture of what their symptoms are, you can now pick out the most appropriate symptom to triage. Because triage is a symptom-based practice, you find the most critical or most important symptom and you triage it using a protocol. So now we're at the point where you've listened to the patient and you now need to go through and select the correct protocol, which we will discuss in more detail in further lectures. Once you've decided on the most appropriate protocol for the situation at hand, you will then follow that protocol, which will lead through a series of questions. When you get to the right response based on the protocol, you'll have the appropriate disposition for the patient based on their symptoms and their past medical history. Again, we'll talk about this in more detail, but for the scope of this lecture, please remember that you need to first pick the appropriate protocol, and then you need to follow it, asking all the relevant questions that the protocol presents, and picking the appropriate disposition for the symptom that the patient is presenting with. When we talk about disposition, it means the appropriate level of care. It's important to remember at all times during nurse triage that you are not treating the patient. You're simply finding out, based on their symptoms and what they tell you, what the most appropriate level of care is. The appropriate level of care could be call 911, go to the ER, go to an urgent care center, come into the office today, come into the office tomorrow, and so on. Now that you've selected the correct protocol and used it to come up with the most appropriate disposition based on the patient's symptoms, it's time to put on your empathetic hat and recognize that the patient has called with a concern and you need to address that concern. So after you've decided what the most appropriate outcome is, you need to give them care advice relevant to the current triage. That advice may be telling them that they need to go to the ER, when they need to see their doctor, or something as simple as telling them that they need to take Tylenol for pain or fever. The protocol will include this care advice, and you need to remember to give it to the patient. Most importantly, as you're going through these steps, in the back of your mind, you want to make sure you're addressing the concern that the patient has expressed. So if the patient called about a fever, you reassure them that the fever is not harmless in this case, and you give them appropriate steps to control the fever so that they feel like they've been taken care of. An important point as you go through the triage process is to realize that you need to stay within the scope of the protocols. This protects you, it protects the patient, and it gives the providers that you work for the confidence that you're following standardized care and you're doing everything within the scope of nursing. If you go out on the internet to find information, you don't know it's reliable, and you're going outside the protocol. If you can't find it in the protocol, then it's outside the scope of what you're supposed to do. You can always call a supervisor or a physician to help you out. Whenever in doubt, always refer back to the physician. Now that you've given the appropriate care advice and addressed the concerns of the patient, the next important step that must never be missed is giving the patient clear instructions about when to call back. Again, the protocols include this, and you need to make sure that you communicate it to the patient. So if they're calling about a fever, you need to give them the relevant information about when to call back. For instance, if the fever persists for this many days or goes above this level, or if you have additional symptoms such as headache and neck pain in addition to the fever, please call back and let's reassess you. The last step is to wrap up the call and make sure that the patient has the opportunity to ask any questions or express any further concerns. You can do this simply by saying, "Do you have any other questions or concerns for me?" You can also reinforce that you're there to help by saying, "Don't hesitate to call back if you have any other concerns or develop any new symptoms. We're here to help and we're glad that you called." In summary, during this lecture we have covered the 10 critical steps that must be included in any triage call. As a starting point, you can incorporate these 10 steps into your practice of triage and then get further into detail about the appropriate protocols. In future lectures, we'll go into more clinical detail about how to separate out symptoms, how to pick the most critical or important symptoms, how to select the right protocol, and how to use the protocols to get the correct disposition. So as you go back and continue doing a great job at triage, remember the 10 critical steps. When you introduce yourself, create a relationship. Collect the correct demographic information so it can be put in the appropriate chart and followed up. Get a brief medical history so you're not missing any important surgeries, medications, or relevant medical information from the recent months or years. Let the patient talk so you can hear what their symptoms are, what they're concerned about. Pick the right protocol based on the symptoms of the patient. Get them to the right level of care based on the protocol. Give them care advice based on their symptom to help them out and take care of themselves. Make sure you give them good follow-up instructions. And finally, always reassure them that you're there to help. You can't underestimate the power of empathy. Over 80% of people who call into their doctor's office may not need urgent care, but they all urgently need empathy, someone to listen, and someone to care. That's the role of the triage nurse, in addition to being a good clinician, a critical thinker, and making sure everybody stays safe. You're also there to provide empathy and care advice and offer patients a helping hand.
Please visit our Learning Center for more videos and articles. Please leave comments and share with your colleagues.